eye on your health this afternoon. February is Heart Month, and heart disease is one of the most widespread and complicated health challenges in the United States and around the world. And joining us live right now is Dr. Mohanty, a cardiologist at Palm Beach Gardens Medical Center. And Dr. Mohanty, thank you so much for joining us. Let's talk about the risk factors. Let's begin with that. What would you like our viewers to know?
Well, thank you for having me on this. For our viewers, definitely heart disease is one of the leading cause of death, and especially among patients above the age of 65. And with the aging population in the country, I think heart disease is very, very prevalent, and we see this a lot, especially in Florida and in the Palm Beach area.
Okay, what are the symptoms? Let's begin with that associated with heart disease. Are they recognized? Please go ahead.
Yeah, the heart disease symptoms are actually a wide variety, and it can happen from a young person to an older person, and the presentation could be completely different. A young patient will have the very classical symptoms of chest pain radiating to the arm, going into the jaw, associated with sweating, whereas an older person may present a very atypical symptom of just merely shortness of breath, could have heart failure symptoms, just feeling lightheaded, dizzy. Some of the patient may present as a first-time episode of syncope or passing out. So a variety of different kind of symptoms could lead to these kind of heart disease. One symptom I commonly see among young patients is chest pain with sweating. If somebody starts sweating just sitting down and having chest discomfort, it is generally something very serious, either a blood clot in the lungs or having a heart attack.
I think for a while, I read online that a lot of, I guess for years, we thought that men were more at risk than women, but that's not necessarily true.
No, actually correct. And for years it was thought that men were more prone, and that was because men had been more diagnosed. They would go to the physician and get checked out much more than women, because women generally tends to be multitasking and busy. But what we found is women tend to actually have the similar, not even more, and their arteries being smaller, they may present very atypical and could have more serious consequences compared to men.
Okay, let's talk about what are the best ways to strengthen your heart, possibly any dietary changes that we should do to reduce heart disease.
So our major problem these days is the obesity. Obesity is probably the biggest pandemic which is going all around the world. So I think reduction of the weight will be the number one risk factor to be helping one. Number two, you may also need to change your diet. So in the diet, you should include more things like nuts, protein, vegetables, and cut back on starchy and carbohydrate-like stuff, whether it is bread or pasta or any of these items, ice cream, very fatty food. So I think switching to a diet which consumes with nuts and fruits, as well as less of carbohydrate and more of protein, would probably help the patient a lot. The daily exercise, and what American College of Cardiology gives recommendation is at least 30 to 40 minutes of daily exercise, brisk exercise, at least 5 and even up to 7 times a week will make it something which will be good for the cardiac health.
Some great tips, and I know you're busy, Dr. Mohanty, so we thank you so much for joining us this afternoon. Dr. Mohanty with Palm Beach Gardens Medical Center.
Thank you for having me in the meeting.
Still